Hi, I'm Dr. Vivek BELATHUR. I'm consultant medical oncologist at Precision Oncology Clinic and also at Fortis Hospital, Vijayanagar Road. So we are here to discuss about one important condition called cervical cancer.
I am Dr. Shamsundar, consultant radiation oncologist at Precision Oncology Clinic. Today we will be discussing about a very important topic called uh, cervical cancer. So before going to cervical cancer, we'll have to see what actually constitutes cervix. So cervix belongs to is the lower part of the uterus is called cervix. Usually uterus has three parts. The upper part is called the fundus, and the middle portion is called the body, and the lower portion is called the cervix. So cervix is that part of the uterus which is between the body and the vagina. So any malignancy, that is cancer arising from this part of the uterus, is called as cervical cancer. There is another cancer called endometrial cancer. This endometrial cancer originates from the body and the fundus of the uterus. However, today we will be talking exclusively on cervical cancer. That is the cancers coming from the lower part of the uterus, which is connected to the vagina. And now coming to the incidence of cervical cancer. Cervical cancer uh, previously was the most common cancer seen in women, Indian women. However, of late, with increased urbanization and increase in standards of living, it has become the second most common cancer, and breast cancer has become the most common cancer in Indian women. Uh, Usually, cervical cancer is seen as a cancer more in the developing world rather than the developed world. So, if you see in the continents of America and Europe, Australia, you don't see much of cervical cancer. The cervical cancer is mainly seen in Southeast Asia, especially India, Pakistan, Bangladesh, and of course in African subcontinent and also in some regions of the Middle East. Uh, Now we will go to the signs and symptoms of
Yeah,
cancer. Dr. Vivek will be telling
sure.
about it.
So I'll talk about risk factors, otherwise, the causes of cervical cancer, and then I'll talk about symptoms. So the risk factors are like, one of the most important risk factors is human papilloma virus. So it's a virus, viral infection. Uh, then apart from this viral infection, then other viral infections can also cause like HIV, etc. And if the age of the woman is less than 21 years at the time of birth, then that also increases risk. Then multiple sexual partners, any history of sexually transmitted disease, and then smoking and are important causes of cervical cancer. So as far as the symptoms of cervical cancer is concerned, the most important symptom is postcoital bleeding, or which is uh, which is nothing but bleeding, vaginal bleeding after sexual activity, and then excessive or intermenstrual vaginal bleeding is the other important symptom. They can also have just excessive vaginal discharge, and sometimes patients also complain of lower abdominal pain or lower backache in addition to all these symptoms. So these are the symptoms of cervical cancer. So then now Sham will discuss about investigations.
So once the patient has these symptoms, bleeding per vagina, discharge per vagina, usually they will go to a doctor, a clinician for consultation. So the first test that has to be done and will usually be done is a pelvic examination. That is, the patient will be put in lithotomy position and the clinician will examine from below through the vagina. So usually when the examination takes place, usually if there is a frank disease, then a mass or an unhealthy tissue will be seen at the cervix. In such a case, what the clinician will do is they'll pick up a piece of that tissue. This procedure is called as a biopsy or a punch biopsy. So a piece of this tissue is taken and sent to the laboratory for histopathological examination. Not always there will be a gross, that is the frank disease. Sometimes it can be very, very superficial changes. That is, it could just be some changes on the mucosa of the cervix. In this time, what they do is something called as a pap smear, in which a wooden spatula is taken and a few cells, that is the smear, is taken from the cervical lips. So this is then put on a glass slide and sent for examination. This pap smear is used not only for diagnosis but also for screening. Usually at risk patients, like what you heard before this, the patients who are at a higher risk of cervical cancer, they can undergo screening in which the clinician again will do a pelvic examination and do a pap smear for diagnosing. So sometimes, even if the patient is asymptomatic, there may be disease harboring and which can be picked up by pap smear. But once pap smear or biopsy shows confirmation of malignancy, that is cancer, the patient will undergo few more investigations called staging investigations.
Yeah. Staging investigations are very important to know the exact stage of the disease, whether the cancer has remained locally or it has spread to other organs. So, for this purpose, we do three important things. One is pelvic examination, as Dr. Sham has already mentioned. So, we'll do vaginal examination to see the extent of the tumor, and then we do two more scans. One is the MRI pelvis, the other one is PET CT scan. Sometimes we do. With these three investigations, we will establish the stage of the disease. So, it can be either stage 1, 2, or 3 or 4. So, stage 1 and 2 are early stages, and stage 3 and 4 are advanced stages. So, this is very important to plan our further treatment. Now, we'll discuss about treatment plans. So, when we talk about treatment, so we further divide these stages into early stages and advanced stages, locally advanced stages. So, early stages is nothing but stage 1A, stage 1B. So locally advanced is anything in stage 2 and stage 3. So Sham will discuss about further treatment.
So usually in early stage disease, surgery is the treatment of choice. So the patient will undergo a surgery in which the uterus will be removed, and most often ovaries and also the lymph nodes will be removed. So this removal of uterus along with the ovaries and the nodes is called as radical hysterectomy. Most often, only this treatment will suffice. However, if there are few risk factors, then the patients will require adjuvant treatment, that is radiation. However, the chances of getting the risk factors in this early stage are very, very less. However, once the patient has advanced, that is locally advanced disease, that is stage 2 onwards, then the treatment of choice will become radiation along with concurrent chemotherapy. So before we go into radiation for cervical cancer, I will very briefly tell you what radiation actually means. See, radiation actually is X-rays. So these are the same X-rays that we use in our X-ray machines or in the CT scan. However, in radiation, that is in radiation oncology, the radiation that we give, that is the X-rays we give, are a little more of a higher power compared to our X-rays and CT scan. But the patient will not be able to feel anything when we give this radiation treatment. So, to make it very clear, radiation per se is an absolutely painless and it will not cause any discomfort to the patient in any way. Most often we hear whether when radiation is given, will the patient feel any warmth or any pain or any pricking sensation? Absolutely not. While giving radiation, neither the patient will have any pain or warm sensation or any other sort of discomfort. So now coming to cervical cancer, here we do radiation for about 25 to 28 days, about 5 days a week. That is Monday to Friday. Usually Saturday, Sunday we keep as rest days. So the patient will undergo treatment for about 5 to 5.5 weeks. The treatment per se will be about 10 to 15 minutes every day for about 5 weeks. And once we complete this radiation, this is called external beam radiation, wherein we will not be touching the patient in any way. The patient will be on a couch and the radiation machine just rotates around the patient. And the radiation will be delivered from a distance. That is why it is called as EBRT, external beam radiotherapy, also called as teletherapy. So once the patient completes EBRT along with concurrent chemotherapy, we do something called as a brachytherapy. As you know, brachy is near. So in this form of treatment, there will be a contact between the radiation and the patient. So here we usually do it as a inpatient procedure, and the patient will undergo this procedure under spinal anesthesia. So once we give spinal anesthesia, we put an apparatus called tandem and voids, wherein the radiation will be delivered into the uterus exactly to the cervix. So we will be treating the nidus of the tumor in the cervix. The advantage of brachytherapy is the patient will receive very high dose of radiation to the cervix so that the disease can be controlled. However, the dose going to normal structures surrounding the uterus like bladder and rectum will be extremely low. So in cervical cancer, brachytherapy forms an integral part of the treatment. However, sometimes when the patient is cooperative and the disease is completely regressed and the uterus is soundable, the brachytherapy can be done without anesthesia also as a daycare procedure. So this will depend only after we do the external beam radiation and see the response. So this is the crux of the radiation treatment in cervical cancer. So coming to concurrent chemotherapy.
So concurrent chemotherapy is the other part of the treatment in locally advanced cervical cancers. So this chemotherapy is given basically to help radiation work better. So chemotherapy is nothing but injections which are given every week. Let's say radiation is for 28 days. We would give 4 or 5 weekly chemotherapies. So the drug is called cisplatin. So it doesn't come with many side effects. The most common side effects which we have come across are some nausea, vomiting, and little bit of tiredness. There won't be any hair loss, no pain. So it's one of the easiest treatments. So patients generally will not even realize that the treatment is going on. So it's mostly the important part of the treatment here in this condition is radiation, and this chemotherapy is given to help radiation work better. So once the treatment is done, we reassess the patient's response to treatment after about 8 to 12 weeks. So this is done with both physical examination, that is pelvic examination, and also with scan, MRI scan. Then we suggest further treatment. So if the patient has responded very well to this treatment, then we keep them under surveillance or follow for next 5 years. So initially every 3 months with simple examinations and also some scans and blood tests, and subsequently every 6 months after 2 years. So this is about treatment of cervical cancer. Thank you.
Thank you.